Hi, my name's Allison Mann, and I'll be your nurse for today. And I've come in to tell you a little bit about some post-operative exercises, as well as just some things that you should be doing throughout your post-operation time. So this will last about 6 weeks. And at the end of the 6 weeks, you'll start to be getting back to normal. But the full recovery time is around 3 months-ish. And it really depends on you and how you're doing. So the first thing that you're going to be doing is the spirometer, and now you should receive one of these after your operation to take home. It's honestly really easy to use. It doesn't take a lot of work. It's just, you'll do it 10 times every 2 hours, and then while you're in the hospital right after your surgery, it'll be 10 times every hour. So the first thing that you're going to do is you're going to put the mouthpiece of the spirometer into your mouth, and then you're going to inhale very slowly and deeply to assure that it works. So it's going to be kind of like this. And then you're going to try and make the indicator, which you should see kind of on the tube part, with the numbers reach the goal mark. And there are several different goal marks per each number. Once you cannot inhale anymore, you remove the mouthpiece and then hold your breath for at least 3 seconds. So basically, you're breathing in. So you just exhale normally after. And then you repeat that about 10 to 12 times. And be sure to wash it after doing this, because we don't want any of the dirt or grime or whatever to get stuck in it, and then it'll just be bad. Also, be sure to keep a log of how high on the spirometer you go up. So per se, you went low on the first day and then it keeps going higher. That'll be a great log, and you can bring it back into us and we can see kind of your progress throughout your post-operation when you come back. And okay, so that is about it for the spirometer. So I hope you understand how to use the spirometer. Just make sure you wash it, please wash it, just because germs and coronavirus is happening right now. It's really easy once you get the hang of it, though. It shouldn't be hard for you at all, because you'll be doing it so much that it'll just become second nature to you. So there's some other exercises that you can be doing. Walking is one of the best exercises to do. So once you wake up, before you go home, you're going to be walking with our nurses and with our physicians. And so walking is just, you don't need to go out on an outdoor walk when you get home. That's not something we want you to do. That's a little bit too exerting. But you can just get up and walk around your house. And now we understand you'll be really tired. That's just a side effect of the surgery. But just make sure you're getting up a few times a day, walking around your house. Don't be doing a lot of household chores, but just walking, maybe going to get some food around your house is a great way just to be like healthy and to keep healing. There are also some other breathing exercises that you can do, and one of these is just take a deep breath. So go. And this will help a lot with your coughing, and so you'll be coughing a good amount just because of stuff in your lungs happening after your hernia surgery, but just the deep breaths really help with your coughing. Some other exercises you can do is literally just flicking your ankles. So kind of like if you just go up and down like really fast, that'll be a good workout for you. And this isn't to get you like healthy. This is not to make you work out. It's literally just to help your healing process. So it's not, right now, if you do it, you're not going to think it's very hard. But right after your surgery, that's a great way to just kind of be moving. You can also do other things, like you can bring your knees side to side, so kind of go like this, just to loosen up your abdomen a little bit. And now these you don't want to do a lot of because they're going to hurt. But just kind of do them every once in a while. Do these as you can. Do not do them all the time. If you do them all the time, you're just going to end up hurting yourself or messing up something that we do. And you honestly might not even do these every day when you first have your surgery. It will just don't do a sit-up. What you're not going to want to do is you're not going to want to be doing like something on your back and bringing your head up, because if you bring your head up, then that's a sit-up, and that could mess up something in your abdomen, and we just did that surgery right there. So you're really just going to want to make sure that you keep your head down on your bed or your back down on your bed, and just move your knees. Don't move anything else. Another thing you can do is like laying on your back and kind of bringing your bottom up a little bit, like kind of in that kind of motion, and you're gonna hold it once you get up here. And what you're gonna do for that is you're just gonna hold it for about 3 seconds, and then you're gonna release. And remember, again, do not bring your head up, because it'll just be bad if you bring your head up, and you'll be in a lot of pain, and it's just not good. Another thing you can do is you can place your hands on your hips and then tighten your stomach muscles a little bit, like bring your stomach in, and now you're gonna feel your muscles tighten, and then once you feel them tighten, you're gonna breathe in. You're gonna breathe in as you do it, and then breathe out. And this will just really help kind of loosen things up still. And then you're gonna hold this again for about 3 seconds while you're doing it. So breathe in, hold for 3 seconds, breathe out. And another thing to note is that for the first and second week, just do these exercises as you can. You're not gonna wanna be doing them 24/7. It's not gonna be something that you're gonna wanna do, and it's really honestly gonna hurt you in the long run if you do them 24/7. So really, if you're laying down and you're just feeling really tired, don't get up and go do exercise. Just stay in bed, and you eventually, once you get maybe a little bit less tired, maybe if you take a nap and then you get up and then you go walk. That'll be great for your first 2 weeks. And then after that, you can kind of start doing these more exercises a little bit more. You also should not be doing a ton of household chores your first 2 weeks. You should honestly just be doing whatever, you feel comfortable with, but don't go around and dust and vacuum your house and mop your house. That's really not going to be good for you, and it's just going to be hard on your body. And I know that you think that's like a really easy thing to do right now, but right after a surgery, it's really not. So just relax. Do the small exercises. Let somebody else in your household do like the household chores, do the dishes, do the laundry. Don't do that. Don't do too much too fast either. So if you feel like you're walking around and you feel like it really hurts, sit back down. Don't push yourself. Just not quite yet. Now, after the end of the first 2 weeks, you can start doing other things. You can start doing household things. Don't do much. Don't push yourself. But you can do them. By the 4th week, you can do a lot more. And then the 6th week, you can start driving. And that's when you'll really start to see yourself have more like freedom and have more like of your normal life. So don't lift anything heavier than 15 pounds for 6 weeks, and we will reassess you and see how much you can lift after that. And I hope you have a great day.